Not Morango, but I represent Moranga. So my question to the CS is, what was the rationale of moving from NHIF to SHA? Because we would have been able to sort out the problems that were identified with NHIF without necessarily moving from NHIF to SHA, because we have a problem with the 104 billion that was spent to move from NHIF to SHA. Was it not possible to sort out the problems in NHIF without necessarily getting into a new system? Can I?
Thank you. That's enough, Mheshimiwa. Beatrice, Senator Beatrice, and then we will have Senator Chute from here.
Thank you, Senator. CS, the impressive data we continue to post to Kenyans like you did this morning, to me, may not matter so much if Kenyans do not get uninterrupted services from the medical centers. And I say this irrespective of whether the functions are devolved or not. Kindly let me know what measures you are putting in place to ensure that members of the public get continuous services from hospitals. Two, the last, Senator Sifuna, health is so key to us. The last is on SHA. I want to start by saying that SHA is working, and I can confirm. But there must be structural issues that needs to be addressed by the ministry. One of them, I suspect, is the waiting period. Like all insurances, Kenyans just have the practice of paying today when they are sick in hospital and making a claim tomorrow. Could that be a challenge that is getting us into the problems that SHA has? Kindly address the waiting period.
Thank you, Senator Chute. And as, before you go, the governor for Mombasa, just a minute, leader. Everybody will get to us. The governor for Mombasa, who is also the chair of the health committee in the COG, has joined us. Governor, with your kind indulgence, join us on the podium here. Yes, Senator Chute.
Thank you very much, Senator Sifuna. My question will be very specific, and it is on the former employees of NHIF. I asked this question when the minister came to the Senate, and I'm asking again the same question, is to know a timeline on how many employees are going to be accommodated in SHA, and the remaining employees, how long will it take to accommodate those employees also? If we can have a timeline so that people, employees, former employees are complaining, asking when are we going to be accommodated in other institutions, if they can give us a program.
Thank you. We are back here, Senator Muma, then we will have Senator Utata, Senator Kinyua.
Thank you.
Please,
thank you, Chair. My first question, CS, I'm disappointed that your entire presentation has not mentioned anything about local manufacturing. There is no way we will ever deliver on UHC if we don't support our own local manufacturers to reduce on the costs of pharmaceuticals, health products, and all those issues. I would want to know what is being done to support our local manufacturers. Just one more. I saw your passion around RRI and reducing maternal mortality. CS, a lot of the mothers are child mothers, and SHA is not supporting child mothers. SHA has decided that they cannot be covered under their parents' insurance. When the 9-year-old is defiled and gets pregnant, then she must be assessed on her own because she's going to be a mother. I think that is a mistake. What is the ministry doing to ensure that every adolescent, pregnant mother or one who has delivered is catered for under SHA.
Senator Kinyua, we'll come back. We are going this side, please.
I didn't.
Okay. Proceed.
Okay. Waziri, I didn't hear you mention the effect of the reduction in donor funding in the ministry. I didn't hear you mention that. Secondly, also you mentioned about the paneling of the hospitals which are outside this country. Then there's something that you mentioned very interesting about partnering with the hospital in this country. Do you deal with the level? Which hospital? Is it level 4, which is partnering with the hospital which is outside the country? And lastly, I just want to know, health is devolved. But you did mention that from where you sit or from your dashboard, you can tell any hospital that is admitting the capacity. At what, may I know what platform you use to know that?
Thank you, Senator Kinyua. We are taking the last batch, then we will come back for the second round. Let's not overwhelm the panel. Senator Issa and Senator Tabitha Mutinda, from here, then we go to Senior Council. Please, we will come back. We have to move across the room.
Waziri, just a quick one. I have a patient from my country. I come from Kwale County, Senator for Kwale County. I have a patient, and this patient has brought this attention to my office. He's suffering from cancer. You know very well, Waziri, cancer it's really killing people in this country. I want to know the procedure. How can this patient be treated out of the country? Because her cancer stage is very critical condition. And she wanted to go to abroad. But what is the formalities now? You said there are some new guidelines to a patient to be taken to abroad. Kindly please furnish us.
Thank you so much, Senator Sifuna. 2 questions very quickly. The other day we were handling the PBS and we realized that the ministry has added 20,000 CHPs. So as to, 13,000 CHPs. The budget still remains at 3.25 billion. How are you going to cater for the difference or the increment of the 13,000 CHPs? What is the methodology that you're going to use to ensure that these CHPs are distributed in the 47 counties, or what the plan? Lastly, very quickly, there has been the delay in SHA reimbursements to the county hospitals. What's the plan? What's the strategy to ensure that hospitals are able to continually deliver their services to the people?
Thank you, Senator Mogeni. We'll close that session. Then we'll take the next batch.
Yes.
If you have asked a question, you will ask again. If you have not asked, we'll give you opportunity. Senator Mogeni.
Yes, Waziri, I heard you declare that nepotism has no room in your ministry. Now, on the latest SHA recruitment, can you give us the figures? The people who are recruited, how is the ethnic composition? I think we are digital. You can get these figures. The CEO is here. Can you give us the figures now, so that we see whether you're walking the talk? That should be tied with the 558,000 Kenyans that are being supported by the national government. Can we know how these 558,000 families are spread in the 47 counties? Finally, there is these Kenyans called the indigents, or the ones who pay the minimum SHA contribution of 660,000. Waziri, why are these Kenyans being denied admission to private hospitals when the facilities at counties are full? Like I've just checked on your platform, Nyamira has a bed capacity of 255. At 12 p.m. today, they are at 249, meaning if they admit the next 6, it will be full. Now, once it's full, the ones who seek admission in private hospitals are denied admission. Why is the government denying these Kenyans admission into private hospitals when their county facilities are full?
Thank you, AC. So, Waziri, we will take those many interventions, and you will determine who or among your officers can answer what question. Over to you. There's a mic.
Thank you. Let me start with you, Chair. I think let me start with the UHC staff. UHC staff, the problem was the division of revenue bill and when it's supposed to come. As of today, the UHC staff earn the SRC rates with all the allowances, and national government is paying. At the 10th of December summit chaired by the President, with the Council of Governors, it was agreed that a committee was formed, chaired by myself and my colleague, the chair of the Health Committee, the National Treasury, the Public Service Commission. The money will be factored in the division of revenue. Once that is done, then the counties will start the process of transiting them. The only problem with the counties was the assurance that the money for future is that's it. On the 12.7 billion, these are like somebody who wants to steal from your supermarket and you arrest him. So we have, I can give you the breakdown of this 12.7 billion. 58% of that mainly are because of missing documents that are legal. All of you senators know that when you go to see your doctor, the claim form is a legal document. It's in the SHA laws. If a facility submits a document for reimbursement without a claim form, that is a rejection, that is fraud. 2, a claim form, all of you senators, when you go see your doctor, the first part of the claim form is filled by you. The second part of the form is filled by your doctor. The third part of the claim form is filled by the hospital administrator. Where you have a situation that the claim form of 500 claim forms are filled by one person with one same handwriting, one biro, that is fraud and we will not pay. Second, and more importantly, if you claim for a maternity, there is a legal document that must be part of that documentation, and it's called birth notification. Birth notification confirms a child has been born. So if you don't provide that birth notification, that claim is rejected. And also, let me tell you, and I'm sure in the Senate there are doctors, and most of us even sitting here are doctors. There are facilities that are reporting that they are claiming for 300 maternity reimbursement, and all of them are C-section. That's against international rules. It's against WHO. So that facility is flagged by the system, and we have many. We have situations where we have inadequate discharge summaries. We don't know when you have discharged the patient. We have a situation where every doctor who went to school, there's something called theater notes. When you're going to a theater, a patient is being taken to a theater, you must have seen there's a file. That's the theater notes. So when you're saying you want to reimbursement for surgery or procedure, and you are not attaching theater notes, that to us, the system will flag, it is. So there are number, clinical, judgments and all these. But to give you the real numbers of these 12.7 billion, Honorable Senator for Nairobi, private facilities are the highest with 59%, accounting for 7.4 billion. So a lot of the fraud is in the private health facilities. It is followed by our county facilities that account for 21%, about 2.6 billion. It's followed by faith-based facilities, 11%, 1.4 billion. And lastly is the national referral hospitals. Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital, Mwai Kibaki Teaching and Referral Hospital, Madare Teaching and Referral Hospital, Jaramogi, all these, MTRH. But of course, of all these referrals, there may be one or two, the highest. They account for 9%, 1.1 billion. That tells you we are not discriminating. It's across the board. Honorable Senator for Nairobi, I'll leave Mercy to talk about SHA Lipa Pole Pole. I'll leave for Mercy to talk about facility reimbursement and foreign procedures and protocols. And most of these things as he answers, are in our website. If you go to our website right now, those protocols, those procedures, all these things, the benefits, all of them are in the website of SHA. But we are under obligation to make sure that the Kenyan. On the issue of the industrial action, I'll leave it to my peers. He is well versed, he's very competent on that. I'll also leave the issue of disability is very controversial vis-a-vis the law that was passed. This is an insurance fund. It has to be sustainable. So I'll leave it to Mercy. We had done something about that. Honorable Muranga is not here. Senator from Muranga is not here. Yes. I think the transition from NHIF to SHA was a legal transition, and he participated in the Senate. I think he can answer better that question. I was not in the Senate. He should have raised that. What made NHIF to be closed and SHA to start? It is the first thing that was done was to change the law. And the senator for Muranga was there. So I don't think to answer that question. I'm only implementing what the law, what you people have passed. To be very honest, Chair. Every day, if you change the law tomorrow, I will vote do. So, Senator Nyutu, I think if I'll look for the answer to see his contribution. Yes. So on the 104 billion, and I want to answer today this very categorically. There is no 104 billion the Kenya government is paying. And if it is paying, it should be seen in the budget. It's nowhere in the budget policy statement. It's nowhere in the budget. The consortium have developed 38 systems. A system for citizens to access healthcare called Afya Yangu. Today, if you go to that app, Afya Yangu, everything about the citizens, Kenyan citizens, will go. For doctors, we have Practice 360 to see the doctor, his credentials, whether his license is valid, whether his scope of practice is right, his practice. For cancer, so we have 38. So the fee is paid by those system owners is what the consortium that built under the DHA, after confirming DHA and the PS as accounting officer confirming, they will be paid. So the people of Kenya are not paying. There are people who are saying that we have spent 104 billion. That is a fallacy. And that is untrue. That is not there. And I really want to say, Honorable Beatrice, very impressive data, uninterrupted service. I agree with you. We have counties where, or referral hospitals where, or private where, in one way or the other, there is uninterrupted facilities. We can give you the 10 best performing counties. And allow me to say it. Mombasa is #1. Kisumu is doing very well. Bomet is doing very well. Elgeyo Marakwet, Kirinyaga, Nakuru, Embu. I can give you the bottom 10. Yeah. Yeah. The bottom 10, Nyamira is one of them. Samburu, Garissa, where I come from, Mandera, Wajir, Marsabit, Turkana. Yeah. Nairobi is one of the best. Kiambu is one of the best, apart from the strike, which I'll come to. But now that it's developing, the bottom counties or the middle counties are now working very hard to dislodge Mombasa, which is #1. And I hope the governor will protect me when I appear before the Council of Governors. Already they have too many problems. But I'll run to the Senate. SHA is confirming strategic issues, waiting period. Where a waiting period is happening is where some facilities want cash. And we are flagging them off. Yes, they don't want, so they tell the Kenyans, citizens, and we have now picked those facilities. They tell Kenyan the system is low, SHA is not working.